day everyone, I am Jennifer Almadamba, a student nurse from Isabela State University at Tiague campus. Today I will be going to perform head and face and neck assessment. First, we need to perform hand washing. Next is to gather all materials and equipment needed. We have here a stethoscope, a pen light, a glass with a water and a straw, and a gloves to protect us from any possible drainage. Next is to explain the procedure to the client. Okay, good day sir. I am Jennifer Almadamba, a student nurse from Isabela State University at Tiague campus. But before that, may you state your name, sir?
I am Ian Dave Sarmiento, ma'am.
Okay, when is your birthday?
My birthday is January 4, 2000.
Okay, so today I will be going to assess your head and face and neck. The purpose of this is to determine if you are currently experiencing any symptoms or has a past medical history related to head and face and neck issues. But before that, I will just ask you a few questions. Do you experience neck pain?
Yes, ma'am.
When did it begin?
When I'm stressed, ma'am.
Can you rate the severity of your neck pain from 1 being the lowest and 10 being the highest?
8, ma'am.
Next, do you experience headaches?
Yes, ma'am.
Can you rate the severity of your headaches from 1 being the lowest and 10 being the highest?
Also 8, ma'am.
Sir, so now I'll just wear the gloves. First is to inspect head for size, shape, and configuration. So, the head of the client is symmetric. Next is to palpate head for consistency while wearing gloves. So, first I will go posteriorly. Okay, so the head of the client is normally hard and smooth without lesions and parasites. Next is to inspect face symmetry, movement, expression, features, and skin condition. Okay, so the face of the client is symmetric. There is no abnormal movement. Can you do this, sir? Okay. Next is to palpate for temporal artery for tenderness and elasticity. Okay, so the temporal artery of the client is normal. palpate for temporomandibular joint range of motion, swelling, tenderness, and crepitation by putting the index finger on each side of the client by asking the client to open their mouth. Can you open your mouth, sir? Can you bite your teeth? Okay, do you hear a sound, sir?
No, ma'am.
Okay, so there is no swelling and crepitation movement. Next is to inspect neck while the neck is slightly extended using a light for position, symmetry, and presence of lumps. Sir, okay, so the neck is symmetric. Next is to inspect movement of thyroid and cercoid cartilage and thyroid gland by having the client sip a small amount of water. Sir, can you sip? Okay, so the thyroid and cricoid cartilage move upward symmetrically. Next is to inspect the cervical vertebrae of the client by having the client flex neck. Okay. Okay, the cervical vertebrae of the client is visible and palpable. Next is to inspect neck range of motion by having the client turn chin to the left and right shoulders. Can you turn left, sir? I mean right, sorry. Can you turn left again, sir? Right. Next is to, can you touch using your chin to the chest? Next is to turn to the ceiling. Okay, wala naman pong masakit, sir. Okay, the movement of the neck is smooth. Next is to palpate the trachea by placing your finger on the sternal notch, feeling on each side, and palpating the tracheal rings. Okay, so the trachea is in the midline. Next is to palpate the thyroid gland. So the trachea is positioned midline. I'm sorry, I mean the landmarks are positioned midline. Next, auscultate the thyroid gland using the auscultate the thyroid gland for growths. Also, if the gland is enlarged, using the bell of the stethoscope. Can you inhale, sir? Okay, exhale. Again. Inhale. Exhale. Okay, thank you, sir. So, no growths are auscultated. So, next is to palpate for the lymph nodes for size, shape, delimitation, mobility, consistency, and tenderness. First, we need to palpate for the preauricular nodes, which is in the front of the ears. So there is no swelling, no tenderness, or no hardness palpated. Next is to palpate for the post-auricular nodes, which is behind the ears. So I will go posteriorly. And also, there is no tenderness, no hardness palpated. Also, next is to palpate for the occipital nodes. No tenderness, no hardness, and swelling palpated. Next is to palpate for the tonsillar nodes. Okay, also there is no presence or tenderness, hardness, or swelling. Next and lastly, palpate for the submandibular nodes. Okay, there is no tenderness, hardness, swelling, palpated. Okay, that's all. Okay. Okay, that's all, sir. Don't worry because all the informations will be kept confidential. Again, thank you, sir.